Good morning, Shaneese. This is Penelope, and I just wanted to respond to your well written post regarding the articles by Chen and Vanderweel. You start out in your post by talking about two questions that you felt were posed for this research article. The first question would be how does religious practices such as attending services, prayer, meditation increase physiological, mental, physical health, and well-being in adolescents? And an additional question: what are the physiological, mental, and physical benefits of adolescents, young adults engaging in various religious practices? And definitely the researchers, these two researchers in this article did answer those two questions that you felt that they posed for this research. You started by talking about several findings that you found that this article presented, and findings were that there was an increase in life satisfaction and attitude for those who participate in religious practices. And for myself, I can attest to that without having to even to do a research personally. You know, when I attend services, I feel that much better. You know, after attending a worship service at my church, as I'm sure many that may look at this post or what that have posted their response to the article would attest to. It says that that compared with no attendance, at least weekly attendance of religious services was associated with greater life satisfaction and a positive effect. And definitely, when for the last couple of weeks I haven't been able to go to church. I've been was out of town on vacation, and then when I came back, my husband was sick, so we missed a week for 3 Sundays we didn't go. So I'm definitely missing it. So I can definitely attest to that. There is a greater life satisfaction when you attend, for me anyway. You go on to say based on the findings that there was a significant correlation between engaging in religious practices at a younger age in the improvement of quality of life, and use the scripture that train up train a child up in the way they should go, and when they're old they shall not depart. And so the scripture bears this out. The earlier you can engage in or introduce your child to the ways of the Lord, it's a guidance, it's a direction for their life. And so it can help to increase a better life satisfaction, because it's not that I have to go it alone. I can rely on the Lord, prayer, meditation, fellowship, to help kind of support me when I feel like I need that support from the Lord, when I'm ill or whatever. You say that there was nothing particularly found interesting for you in this study, and that this study just really validated, and what you already understood, that engaging in spiritual practices improved our lives in so many ways. And Shaneese, I attest to that as well. Some strengths also were, you said, using a longitudinal study, which it was stressed out over years. I think from 8 to 14 years. I think they said they followed some of the participants, but some of the limitations was the population that they used. The population was specific. I believe it was all females, nurses, children, and of a high socioeconomic, which is not a good example of the population, United States population as a whole. So they could have, may have used other genders and other socioeconomic, other ethnicities. I think that would have been best, a better study. But that being said, I enjoyed reading your posts, well-written posts, and I look forward to reading more of them. Thank you.